Hello, I'm Edouard Demeire, your expert of the CELFORPHARMA course, Pharma Marketing for Non-Marketing Functions. The objective of this short video is first to ensure that you have a good understanding of the contents and objectives of this particular course, and secondly, to understand the pedagogical approach of this highly compact course. I have a dual background. First, I'm a visiting professor of marketing in a number of business schools, including, for example, CEDEP, which is located here on the INSEAD Business School campus here in Fontainebleau, France. Secondly, I have also consulted and trained a lot of executives from a variety of pharma companies such as Novartis, AstraZeneca, Lilly, and most recently Roche. Let me introduce the contents and the objectives of Day 1 and Day 2 of this particular course. Day 1 is about the basics in pharma marketing, and the first objective is to become familiar with terminology, concepts, decision-making processes which your colleagues in pharmaceutical marketing use so that you can better collaborate towards achieving two common goals. Firstly, the patient's well-being, and secondly, the pharma brand's commercial success. The second objective is to understand the drivers of a pharma brand success and how you can contribute to achieving commercial success in an environment that has changed rather dramatically. For example, we see renewed market access hurdles, we see the internet, we see new influencers, decision makers, just to mention a few of them. Day 2 is about marketing as a cross-functional activity. So we will cover marketing's interactions with various functions they encounter within a brand's product lifecycle. Firstly, for example, we will talk about pharma marketing's input to R&D. Secondly, we will talk about medical marketing interface, we'll talk about sales, we'll talk about account management, and finally, a pretty large section is devoted to the interface between marketing and market access, so that you can understand how each of these activities can align with a brand strategy and also discover tactical synergies between these functions and the marketing function. Let's talk a bit about the pedagogical approach. The course will alternate plenary interactive lecture discussions with casework in groups so that you both get the conceptual background through the lecture discussions and also practical implementation skills through casework. We will use cases in traditional markets such as heart failure therapies, for example, but also innovative markets such as monoclonal antibodies in oncology indications. While the three cases we will use are easy to understand for participants with little pharma background, it will be beneficial to read the cases before the course, as there will be little time to do so during the course itself. So thank you for pre-reading the materials before the course starts. There are 8 reasons why you should attend CELFORPHARMA courses, which all have the following in common. In the meantime, I'm looking forward to meeting you on what participants have reported is an up-to-date, excellent, but very compact course.